Welcome to the Champions of Active Women podcast. In this podcast, we will interview individuals who have been successful within athletics and beyond. We hope that these interviews will encourage and inspire girls and women to be active for a lifetime, to reach their goals, and to break new barriers in sport and life. This podcast is brought to you by the Active Women's Health Initiative and the Sports Medicine Research Institute at the University of Kentucky. The mission of the Active Women's Health Initiative is to optimize health and promote physical activity and wellness for girls and women across the lifespan. We hope you enjoy our conversations and join us in understanding women's health today to ensure women's health tomorrow. Hi, I'm Dee Dogonsky, your host of the Champions of Active Women podcast. Today I'm delighted to be speaking with Dr. Lori Bolgla. Dr. Bolgla is a professor in the Department of Physical Therapy and the Kellett Chair in Allied Health Sciences at Augusta University. She received her undergraduate and post-professional master's degrees in physical therapy from the Medical College of Georgia. In 2005, she obtained her doctoral degree in rehabilitation sciences from the University of Kentucky. For over 15 years, Dr. Bolgla's research has focused primarily on the management of individuals with patellofemoral pain. She has expertise in differences in ACL injury and factors associated with knee pain between males and females. Dr. Bolgla is an active member of the Active Women's Health Initiative Advisory Board, and I'm happy to have the chance to speak with her today via Skype. Welcome, Lori.
Thank you very much. It's truly a pleasure and an honor to be invited.
Great. Well, first I want to say thank you for being such an active member of our Active Women's Health Initiative Advisory Board. And I thought you could just get us started today by talking to us a little bit about why the health of women and girls is so important to you, including physical activity and injury prevention.
Okay, yeah, Grace, it's truly an honor. I think the most important thing is that so much of the research and just directives have always been toward male athletes, in my opinion. But luckily with Title IX and changes over the last 30 years, it really has shown the impact that women's sport has really made on the community and the world as a whole, especially, with the women's soccer team and, how wonderful accomplishments they've made and how it's so important to have good role models and stuff. And but I think the more important thing is that physical activity is so important because it truly affects people across the lifespan. And, it's easier to be physically fit and healthy in your younger years, but then life gets in the way. People get married, you have kids, your careers, become very time consuming, and you really kind of forget to take care of yourself. And I just think it's so important to stay active, stay healthy, and by having a good balance between that, it just makes your work environment grow a lot more productivity. And it's, you're only given a real short period of time in the whole scheme of things in this world. And I just think it's important to be able to make the most of every day and to, really embrace health and the benefits, because just a little bit of change can make a huge impact on people.
I love that quality of life approach to thinking about physical activity, that we have this limited time here and that we want to make the best of the time that we have here and be the healthiest we can be. So could you talk a little bit about your own experiences with physical activity and sport over the course of your life?
Oh, yes, I'd be glad to. Fortunately, I'm not a great athlete. However, I was very, try to be as active as possible. Yeah. And, did the typical growing up things of running, playing basketball. Soccer wasn't as big because, I was born in the early 60s. Mm-hmm. Basketball, volleyball, those type of things. Got very interested in equestrian and still have that bad habit, which will make you very broke. But it does involve physical activity. In my 20s, I was very active. I was able to maintain it. I was an avid runner, running 30, 35 miles a week, and thought, I could do this the rest of my life. But actually, that's very unrealistic. So, I got into my 30s, my 40s, and just the challenge or the bulge kept going. And it's just so easy just to get out of shape and not take care of yourself. And
mm-hmm.
You get to the point where you kind of look in the mirror and you're like, this is not the person I was or I want to be. And, just from my own personal experience, I just took a look in the mirror and just said, you know what, you can make changes, you can improve your weight, and just, making little changes with things like that have been a huge impact in terms of not having to worry about high blood pressure, being off cholesterol medicine now because of that. And just like I said, your whole outlook, it just makes, I keep getting onto this quality of life, but it just makes your mind clearer, and it just makes things easier instead of having to, be consumed with, oh, I have to get up and move. You just get up and bounce around. So, anyways, I don't know if I answered your question to the
Yeah, absolutely. So, you had a few structured experiences early in your life with physical activity and then kind of shifted into running as you got older. You said that running wasn't a sustainable thing for you. Did you have an injury experience, or was it just not a long-term lifetime activity for you?
It was a combination. I actually never went to the doctor for it, but developed patellofemoral pain. It's a kind of my expertise,
Yeah.
and it was more from personal experience. And I think what was most telling of it was the fact that I did have knee surgery 4 years ago for patellofemoral joint osteoarthritis. So it's kind of like, what are things that maybe we can do, especially with a common knee problem that people typically don't go to the doctor with, because usually they're told it's growing pains, or, you
Hmm.
just need to not do this or not do that. But it really does have long-term impact. And I think a lot of that did have to do with not maintaining as healthy a lifestyle, is because if it hurts to be active, then no one wants to be in pain. So
Right. Yeah.
if there are things that we can do early, and being able to capture these individuals early in life. And patellofemoral pain is so prevalent in females. And, I look back just looking at high school girls, middle-aged, and, being able to capture that group and instill healthy lifestyles. I'm a big researcher. I believe in exercise, but the most important predictor from all the research I've seen with patellofemoral pain is your body mass index. And, that
Hmm.
is something that I don't think we address enough. And I think nutrition needs to be added to a lot of the rehabilitation approaches. And unfortunately, and I've gotten more comfortable with it because I can speak from my own experiences, just talking to patients and the community, and just explaining the importance of it and getting people to buy in of just these small changes can have a huge impact, on healthcare costs, and again, just that quality of life. It's just been a wonderful experience for me personally.
So you mentioned having patellofemoral pain yourself, and you're now a professor of physical therapy at Augusta University. And so was that your own pain? Did that lead at all to your career path, or could you talk about how you got interested in this field?
I've always been interested in the knee, and I was particularly interested in ACL injury. However, when I went to the University of Kentucky, my dear friend Dr. Tim Uhl, for some reason, thought that I was the patellofemoral expert. So I just went with it, and it was actually one of the best career advice roads I ever went. And
Yeah.
the reason I really do enjoy it is because it is non-surgical treatment is the recommended treatment of choice. And I just think that we can reach people, because there's so many people out there that do not go to the doctor to seek help. And I just think it's one of the most underserved areas, just because it's not something, for lack of a better term, that's quote sexy, like, having some type of an injury and you can have surgery for it and, kind of get on with life. It's really something that is a lot of contributing factors. I just think it's a way for someone who believes in rehabilitation and non-operative treatment. I'm not putting down operative treatment because I know it's very much indicated, but I feel like as a rehabilitation person that's where I can really make an impact. So that's kind of where I came from with it.
Are there a certain group of people who would benefit from hearing this message, do you think?
Oh yeah, absolutely. I think probably the most important group is if you can get to the middle schoolers and high schoolers, because I think that's where a lot of this develops. Um, I see, just being on a medical campus, a lot of graduate students who are in medical school, dental school, and what happens is their physical activity goes from 100% to like 0% because their life changes. They're in classes, the curriculum is unbelievable, stressful and all that. And I just think it's important to be able to reach that group too, just to say, it's okay, you know, we understand that you can't do everything you need to, but these are ways that we can help modify and still keep you active and still, make the time so that you can be healthy yourself, which is going to help you succeed in your future career. So I'm very interested in those groups, I guess, in particular.
Yeah, and it sounds like those are important groups to target,
Mhm.
and maybe for two different reasons. So in the middle school children, what kind of programs or what kind of research questions would you have in that group?
I think the biggest thing is actually a couple things from a research perspective. One is really maybe figuring out what are potential risk factors and making it so it's a more heterogeneous group instead of just, I understand with research with homogeneity and that type, but you have lots of different quote athletes. You've got
Mhm.
people who not everyone has to be on the soccer team or the basketball team or volleyball team, but you just need to be active. And I think that if we can devote more time and resources and understanding how we can keep those group of individuals, which is the majority,
Mhm.
healthy lifestyles, I think that's important. And figuring out what are the true contributing factors, because even though we think we know some of them, there's not nearly enough prospective studies to be able to say definitively that these are risk factors associated with patellofemoral pain onset. And I think part of the problem is that we tend to get individuals once they've reached maturity. But if you can get them, during adolescence, I think that can give you a huge amount of information. And it may be that risk factors for someone who's skeletally mature may be different for those who aren't. And I just think um, it's so important to instill all these healthy lifestyles, early so that it just becomes a way of life for people.
Are there messages? Are there things that we know from research already that we could convey to either middle schoolers or other groups of people, um, that are maybe different for boys versus girls or men versus women?
Yeah, that's a hard one just because in the adolescence we really don't understand, but there's some preliminary evidence that I've used. Granted, it is retrospective that
Hmm.
there seem to be differences in terms of impairments associated with at least with the collegiate age, the 20-year group between males and females, and it does seem to go with the females a lot with the importance of core strengthening, hip strengthening, also just looking at movement and how people do move and being able to instill good movement patterns, which is really the neat thing about it is that a lot of the aberrant movements that you see in people who are at risk for sustaining injury to the ACL is also, I think, very similar to those with patellofemoral pain. The problem with patellofemoral pain is that it's so multifactorial and we don't have a good diagnostic classification system to drive interventions, but we do have a international research group who every 2 years we meet to um, get our information to build the body of knowledge. And I know that there's a lot of work over in Denmark looking at specifically at the adolescent population, and it just really seems that the key point with those folks is just activity modification and just keeping people active, but finding the way that people can stay active in that age group without causing their knee pain.
So keeping people active, and doing any kind of modification to avoid that knee pain. And then, but it also sounds like we still have a lot of work to do in really understanding why it occurs and how we can better prevent it.
Oh, absolutely. And
Okay.
that's my life dream is to be able to, there've been a little bit of prevention programs, but not to the nearly the extent of ACL injury. And again, I think the most important thing is that because we really don't know what is it, what really causes it. And it's, I think just because of the multifactorial nature of it and being able to identify, different groups and being able to have individually tailored interventions and individually tailored prevention programs. But again, I don't believe that. I think we're like at the infancy of the prevention
We're
program, and
not quite there yet.
oh,
But
not like the wonderful work that Dr. Ireland's done, and Tim Hewitt's group over, and Lynn Snyder Mackler's group, over the last, 20, 30 years. Unfortunately, we're way behind the eight ball with that.
well, that just means that you'll have some job security for the rest of your life,
Well, you know
and
what? I was just
something
thinking
to
that.
always ask, a new question to always ask.
Right.
Hmm. So what are some of the biggest ideas in your field? Some of the whether they're yours or just in the broader field. What are some of the newest, most novel ideas that you think we should know about?
Um, for me personally, because again, I never even realized that patellofemoral pain because I was growing up. It's like, you just kind of suck it up and you ran around
Yeah.
the the field with your horrible Converse shoes, and if you got shin splints, you just kept running. So,
Mm-hmm.
but is the for me, at least for my passion, is being able to identify people who might be at risk of developing OA and being able to develop therapeutics for the younger people with patellofemoral pain. And I've got some preliminary data that have been published at looking at urine biomarkers. And can you take a urine test and see, do these people have biomarkers that are consistent with patellofemoral joint OA or knee OA in general? Because we do know that patellofemoral pain and patellofemoral is potentially a risk factor for patellofemoral joint OA as well as knee OA.
Mm-hmm.
So that's really where I'm kind of coming from, is that if nothing else, if we can demonstrate that if you have people who have elevated biomarkers but not any changes on x-rays or MRI, because those may not become evident for 20 years, it highlights the importance of early intervention and prevention. And that's really where the focus of my research is going.
I love that idea, that very early identification of
Mhm.
potential risk factors for osteoarthritis, something that could impact your movement and your mobility for the rest of your life.
Oh, absolutely. And it's also important to appreciate that, one of the risk factors for OA is female sex. So that even is shows the importance, where my passion is really trying to look at the lifespan of bone health.
In particular for women or for both
It for women.
sexes? Okay.
Yeah, I'm biased toward women just because I feel like it's just so prevalent, and associated with that is, women, and it's been published a lot more in the public media, just about, cardiovascular incidents in women, and they're just also tied together, because if you have osteoarthritis, it's hard to move around. If it's hard to move around, it's hard to maintain your cardiovascular fitness. Cardiovascular problems are associated with diabetes, so it's just a horrible, kind of it's almost like the older female triad, I guess,
Yeah.
with all the bad things.
So you talked about, along those lines of health implications, you talked earlier about your own transformation and how you were active in your younger years. You took a little break and now currently you're active again. Could you talk about that transformation and some of the things that motivated you to make changes and be active again, and maybe some of the challenges you experienced?
Oh, absolutely. Yeah, I think the biggest challenge is time. And when as you get older, your commitments are just you're spread thinner and thinner between work, family, and it's really just finding that balance. So I think, as corny as it is, it doesn't matter what someone tells you about how wonderful health is and blah, blah blah this and blah blah that. The person really has to be. You have to get the buy-in for it. And that's something that individually people have to make. But I feel like through this initiative, because it's got such a wealth of knowledge and so many diverse people, that if you can at least, spread the information and really, speak from the heart and really share with people and say, this is really happening, and kind of having that personal connection. I think that's really important. But again, I just had to make up my mind that, I wanted to feel better. I was tired of being sluggish, and you have to make yourself do it, but the benefits are like exponential compared to the effort that you have to do. And it's just little changes, instead of trying to, look for the parking lot angel and get the closest parking lot, I park as far away as I can. Instead of going directly to the cookie aisle, I'll walk around the grocery store and then pass and forget to go to the cookie aisle. So that's a good thing. So, it's just little things like that. Remembering to stand up, move around, um, like I said, it's just a lot of little changes, but together they add up and make a big difference, and it just gives you more energy. So then you're more willing to, it may be 10 o'clock at night, but I would, go out and walk as long as it's safe. Going and walk the dog for 30 minutes.
Hmm.
And it does help that I had to move in with my 93-year-old father, and he has a crazy black lab with lots of energy. So I spend the night with him most nights, and that dog will not stop barking until I take her on a walk. So
Yeah.
that is my true motivation, is so that the dog will shut up.
Yeah. Well, our four-legged friends are, I mean, there's actually been research on that, that people who
Oh,
have
really?
yeah, people who own dogs are more likely to meet physical activity guidelines. And there's a pretty strong body
Interesting.
of research on that now. And I know mine does the same thing. I definitely get more activity because of my big girl dog.
Yes. So
Yeah.
my inner one of my study is it does make you walk.
Yeah. Well, whether it's a dog or a person, I think that's really good advice to have some kind of accountability partner. For yours just
Oh,
happens to be a
absolutely.
barking dog.
That's right. And do have an accountability, and even at work, I know I didn't do it, but I should have, is that we do have people at our institution who do have walking groups, and
Mhm.
try to have friendly competition with it. So
So you mentioned earlier also this transformation that you've gone through, and kind of the process of going through becoming more active and losing some weight, and how that impacted your patient encounters. So could you talk a little bit about how you use your own personal experiences and your patient encounters?
oh, absolutely. But because I've had patellofemoral pain. I've had, just with age, you get back pain and stuff. And I think when you're talking to your patients, a lot is just having that connection and the buy-in. And, I think they can tell that when someone's telling you something, because like it really is something they experience versus kind of like, this is what I'm supposed to tell you,
Hmm.
like reading from the script. So I've done that. And like I said, I've tried to make a connection with patients that way. Just again, just through my clinical experience, people have to buy in. They have to, see, so what is this truly, what is the benefit, and how can, it's part of a marketing job in a sense,
Hmm.
just to get the buy-in. But like I said, when you can really share the benefits and really, just, encourage people, I think that's huge. With that. And I think it's important, even with your personal health care provider. I've been fortunate to, for a family practice caregiver, actually go to a physician assistant who is very encouraging, and is always willing to give me like extra tips on things like, okay, I've noticed you're doing this. Well, why don't you, add this to your diet? So I think a lot of it is the more the things that you don't expect to get from your physician that you should really seek, and getting that nutritional advice, and kind of what are some things, just breathing, some deep breathing, every 2 hours can make a huge difference. So it's just a little non, I guess, less alternative, more alternative type things than just give me the pill to make me feel better, because that doesn't work for me, at least.
Yeah, and I think the small change idea is really important too,
Oh,
that it
yeah.
doesn't have to be a huge step. It can be lots of small steps to make a big
Hmm.
difference in the long term.
And then it becomes ingrained in your habit, and then
Mhm.
it doesn't even seem like you're doing anything.
Yeah, and that's a good thing for
Yeah.
long-term health. So what advice do you have for girls or women who are trying to be active, from a physical activity promotion standpoint, but also from an injury prevention standpoint?
Yeah, I definitely, with injury prevention, the biggest thing I can say is just take small steps, and to don't worry about what so and so's doing or not doing. Just take small steps, figure out what works best for you. Part of it is what works best in your schedule, at your whatever point of your career or your school or whatever, because if it's not realistic, you're not going to be able to keep it. But I do know that just by taking it slow, and I've actually returned to running, and I never imagined, I hadn't run in 30 years, but I went really slow at it. Don't go 0 to 60. It's okay to do walk run. You just have to be careful and listen to your body, because if you do experience discomfort or pain, there's a reason for it. And the old mantra about no pain, no gain is, I have to respectfully disagree in most instances, because pain is actually your friend, because it's telling you, okay, slow it down. We need, and also recovery.
Hmm.
I think that's something that we don't do. And the other thing, is the importance of sleep. I've never appreciated how just getting an extra hour of sleep, and I know it's hard, trust me, because I try to get the usual 7, which last night I got 6, I think, if I was lucky. But just really focusing on just all aspects of it. And I think together that helps with injury prevention. Like I said, it's just activity modification, taking it slow, listening to your body, making sure you have adequate recovery, and appreciating that what I could do, 30 years ago, I just can't do now. But I can still be active, just in a different way.
Yeah, that's great advice for thinking about the long haul, right? The lifetime
Oh, yeah.
physical activity that promotes health-related quality of life. Mm-hmm. Is there anything else you'd like to share with our audience today?
Oh, no, I just, like I said, I really appreciate, the opportunity. I'd like to say that I've always been a big proponent of wellness and health, but that was a lie because I did let myself get down. But it's such an honor to be able to, work with this group, and the leadership's wonderful. And, just hoping with my little bit of personal experience, I can at least help impact someone else. And it makes a huge, like I said, just lots of little changes or have just made a real big input, just in terms of just outlook and just getting up every morning, and I'm like, it's going to be a really good day. So that's my mantra.
Well, I appreciate all of your perspectives today, and I really appreciate your time.
Oh, and I appreciate y'all's time. This is, like I said, this is a wonderful group, and I feel really honored to be a part of it.
Great, thank you.
Thank you.
Thank you for listening to the Champions of Active Women podcast. This podcast is brought to you by the Active Women's Health Initiative and was produced by the Faculty Media Depot at the University of Kentucky. If you enjoyed this episode, you can listen and subscribe to all of our episodes wherever you find your podcasts. For up-to-date information about the Active Women's Health Initiative, you can find us on social media at UKAWHI. Thank you for supporting us as we work to promote health and physical activity among girls and women across the lifespan.